Hi, my name is Randall A, and you found me on the Infertility Channel. I'm a reproductive medicine specialist in Orlando, Florida, and today we're going to be talking about something near and dear to many of your hearts, ovarian reserve. In other words, how many eggs do you have left? We have tests that can tell us about your ovarian reserve, how many eggs remaining. Recall that during a woman's reproductive lifetime, the number of eggs that she has decreases. There is a precipitous falling off of egg cells between age 37 and 38. So it is certainly more difficult to become pregnant as a woman ages. So the ovarian reserve tests have a moderate predictive value or ability to tell us about how you're going to do with treatment. The number one test in this regard is probably a baseline follicle stimulating hormone, or FSH. We can check the FSH value and tell how you're going to do with those stimulation medications. So why do we look at FSH and estrogen level? That helps us to know how well your pituitary and ovary are communicating. The ovary talks to the pituitary, and the pituitary has to talk to the ovary. So these tests help us know what's going on in that communication link and how many eggs are there. Another test is the so-called anti-Mullerian hormone, or AMH. AMH is a protein made by the granulosa cells. Now, the granulosa cells are those cells that completely surround the egg-containing cyst, the follicle. A follicle has thousands of granulosa cells completely enshrouding and nourishing the egg. So one of the protein products is called AMH, or anti-Mullerian hormone. That is present during a woman's lifetime from the time of birth, peaks around age 20, and we know how it is supposed to go throughout a woman's reproductive years. There was a paper looking at 17,120 women and looked at the average AMH from age 20 through menopause. So they looked at all of these women to help us know what normal is at any given age during a woman's reproductive lifetime. So anti-Mullerian hormone correlates very well with another index of ovarian reserve, another test that we do. It's an ultrasound test. And this is the so-called Antral follicle count. Follicle, you know, Antral means that these follicles are about 3 to maybe 8 or 9 millimeters in diameter. We know that a hyper-response to medications is going to likely occur if a woman has more than 14 antral follicles, whereas there's not going to be much of a response if she has 3 or fewer follicles. A good response could be anticipated if a woman has a total of 8 to 10 follicles, so 4 or 5 in each ovary. There is a test that has not been used so much recently for predicting ovarian reserve. It's the so-called clomiphene citrate challenge test. It's sometimes called the Clomid Test. On day 3 of that cycle, a follicle stimulating hormone level is evaluated. Then on day 5 of the cycle, a woman will start 100 milligrams of clomiphene citrate, or Clomid. She'll take that 5, 6, 7, 8, and 9. Then on the 10th day of the cycle, another FSH value will be obtained. If the FSH values are abnormal on either day or additively, then that's a problem. And we know that it has no better predictive value than that single FSH measurement on day 3. So it's not used so much anymore. It's mostly of historic interest. That's it for ovarian reserve tests. Certainly, you can talk to your reproductive medicine specialist in more detail about your particular case. I'd like to tell you about one of my patients. 44 years of age, she had gone through multiple stimulation cycles, and she had one of those abysmally low anti-Mullerian hormone levels. Her FSH was already 19. But she thought that she could do something about it. I had recommended donor egg IVF to her, but she knew that she could do this. So her husband actually called me and said, you know, she read something on the internet that if you eat a lot of soy in the first half of the cycle and a lot of yams in the last half of the cycle, you can influence your estrogen first and then your progesterone. And he asked if there was any credibility to that. I said no. And he says, well, not only is it a problem, he says, I hate soy, and he says, my wife is really getting fat on all those yams. And I said, you really can't believe everything you read on the internet or see on the internet, and that would include me. In medical school, we had a saying that always doubt the previous physician's diagnosis, especially if you are he, and I am he. So thanks for joining us this week. We really appreciate your being here. Subscribe if you haven't. If you have a comment or question of a personal nature, please write me at the email address below, and I'll see you back next week. Thanks so much.